Hi everyone, today we'd like to talk about carpal tunnel syndrome.
Have you ever experienced pain, tingling, or weakness in your hand and wrist? You might be dealing with something called carpal tunnel syndrome. Carpal tunnel syndrome occurs when the median nerve, which controls sensation and movement in the hand, gets compressed. This happens as the nerve passes through a narrow space in the wrist called the carpal tunnel. The condition is often caused by swelling of the tissue around the tendons in the tunnel or narrowing of the tunnel itself. This puts pressure on the median nerve and can even reduce blood flow to the area. Over time, the nerve becomes irritated, cause pain or discomfort, leading to the symptoms like numbness, tingling, pain, and weakness in the hand and forearm. Anatomy of carpal tunnel syndrome. The floor of the carpal tunnel is formed by the carpal bones, which include the scaphoid, lunate, and triquetrum. These bones form the bottom part of the tunnel, providing structural support. The roof of the carpal tunnel is formed by the transverse carpal ligament, also known as the flexor retinaculum. The sides of the carpal tunnel are formed by the pisiform and hamate bones on the ulnar side, and the scaphoid and trapezium bones on the radial side. This structure complete the passage, encapsulating the median nerve and flexor tendons as they pass from forearm to the hand.
The flexor retinaculum is a fibrous band that wraps across the front or the palmar side of the wrist. It's also known as the transverse carpal ligament. Between the carpal bones and the flexor retinaculum, there is passageway from the forearm to hand called the carpal tunnel.
The carpal tunnel is a narrow passageway found on the anterior portion of the wrist. Its main function is to provide a passageway for the median nerve and tendons from the forearm to the hand. So why do we need to provide a passageway for the median nerve and tendons? Basically, the median nerve, which passes through the carpal tunnel, controls sensation in the thumb, index, middle, and part of the ring fingers. It also controls motor function in the tendon muscle, which are important for fine motor skills like gripping and pinching.
There are three tendon muscles make up the muscular bulge at the base of the thumb, which is responsible for thumb movement. The abductor pollicis brevis causes thumb abduction. The opponent's pollicis causes thumb opposition, which is the movement where the thumb reaches across the palm of the hand to touch the tips of the finger. The flexor pollicis brevis is responsible for thumb flexion.
Tendons. The carpal tunnel contains tendons that connect muscle in the forearm to the bones in the hand and fingers. These tendons are involved in moving the fingers and thumb for activities such as grasping and typing. The tendons involved are the flexor tendons, the flexor pollicis longus, which control thumb movement, and the flexor digitorum superficialis and flexor digitorum profundus, which control finger movement.
Flexor digitorum profundus. The origin of this muscle is on anterior surface of ulna and anterior surface of interosseous membrane. The insertion is on distal phalanges of middle forefingers.
Flexor digitorum superficialis has two heads, the humero-ulnar head and the radial head. The origin of the humero-ulnar head is the common flexor origin and the coronal process of the ulna. The origin of the radial head is the oblique line on the interior surface of the radius.
This flexor pollicis longus. The origin of this muscle is on anterior surface of radius and anterior surface of interosseous membrane. So the insertion is on distal phalanx of thumb.
Lumbrical muscles are small worm-like muscles in the hand and foot that help with fine motor, control, and precision grip. There are four lumbrical muscles in each hand and several in the foot. Lumbrical muscles are unique because they originate and insert into tendons rather than bones. The first and second lumbrical muscles are supplied by the median nerve, while the third and fourth are supplied by the ulnar nerve.
So what are the causes of carpal tunnel syndrome? The first one is repetitive motion like doing things that repeatedly bending the wrist or gripping hard. Next is trauma injury at the wrist and posture. Poor posture can compress nerves in the neck and bother the hands and arms. And next is keyboard position. Using a computer keyboard that's positioned incorrectly can contribute to carpal tunnel syndromes and other medical conditions. So, the other medical condition that commonly related with this syndrome is diabetes, rheumatoid arthritis, acromegaly, pregnancy, osteoarthritis, hypothyroidism, obesity, and chronic kidney disease.
Symptoms like numbness or pain in the thumb, index, middle, and ring fingers, and sometimes both hands. A common sign is a pinch and needless sensation, paresthesia, in the fingers, which may extend to the forearm. People may also experience weakness in the thumb and palm, making it hard to grip objects. Other symptoms include a tight or swollen feeling in the fingers, even without visible swelling, and burning or tingling sensation, especially in thumb, index, and middle fingers. Anatomical structure of the bone of the hand. The bones of the hand consist of three main groups, which are carpal, wrist bone, metacarpal, palm bones, phalanges, finger bones.
For the carpal bone, it has 8 small bones that make up the wrist and arranged into arrows. For the first arrows is a proximal row that has scaphoid, lunate, triquetrum, and pisiform. And the other row is a distal row which has trapezium, trapezoid, capitate, and hamate.
Metacarpal bones, or also known as palm bones, consist of 5 parts, which is first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and fifth metacarpal.
The phalanges, also known as finger bones, are divided into three main types: proximal phalanges, intermediate phalanges, and distal phalanges. The proximal phalanges are the bones located closest to the hand. They consist of the first, second, third, fourth, and fifth proximal phalanges. The intermediate phalanges are found between proximal and distal phalanges. They are present in all the fingers except the thumb, which does not have intermediate phalanges. They consist of the second, third, fourth, and fifth intermediate phalanges. The distal phalanges are located at the tips of the fingers. They consist of the first, second, third, fourth, and fifth distal phalanges.
Relationship of muscular system and nervous system. The median nerve controls the muscles at the base of the thumb, the tenos muscles, which are important for fine motor movements in the hand. The tendons passing through the carpal tunnel connect muscles in the forearm to the fingers, enabling movement such as gripping. Nervous system. The carpal tunnel is a key part of the peripheral nervous system, allowing signals between the brain and hand. Compression of the median nerve inside the carpal tunnel can cause symptoms like tingling, numbness, or weakness in the hand, signaling a disruption in nerve function.
Next is skeletal system. The carpal tunnel is formed by the carpal bones and the transverse carpal ligament. If there is any injury or disease affecting the bones like arthritis, it can lead to narrowing of the carpal tunnel and increased pressure on the median nerve, leading to symptoms of carpal tunnel syndrome. And the last one is cardiovascular system. So, swelling or inflammation in the carpal tunnel can affect the blood vessels, reducing blood flow to the hand. This can worsen the symptoms of carpal tunnel syndromes and cause discomfort in the fingers or wrists. So, how do we diagnose the patient of this syndrome is the therapist will check your medical history and give a few physical exam or do a electrodiagnostic test.
One example of physical exam is the Phelan test and Tinel test. This is an example of an electrodiagnostic test.
The treatment for carpal tunnel syndrome is splitting your hand, anti-inflammatory medication, surgery, worksite changes, and exercise.
This is an example of surgery that can be performed for carpal tunnel syndrome. This is an example of exercise that can be done for carpal tunnel syndrome.
Carpal tunnel syndrome is the most common nerve entrapment condition worldwide. Caused by compression of the median nerve in the wrist, it leads to symptoms like numbness, tingling, and hand weakness. Diagnosis relies on symptoms and physical exams, which help decide treatment. Treatment options include non surgical methods such as wrist splints, physical therapy, and injections, as well as surgical procedures like carpal tunnel release surgery. Non surgical treatments are used for mild cases, while surgery is for severe or persistent symptoms. Advanced diagnostic tools like nerve imaging and electrophysiological tests exist, but their exact benefits are still unclear, resulting how to best combine clinical, functional, and anatomical information remains a challenge. Early diagnosis and treatment are important to improve symptoms and prevent lasting damage. However, carpal tunnel syndrome is very common, placing a heavy burden on the healthcare systems and impacting patients' quality of life. More research and clinical trials are needed to clear uncertainties, improve treatments, and ease the strain on healthcare systems while ensuring better outcomes for patients.